Growing up in the 80s, I was aware of 3 different types of lasers. Pretend laser beams that you shot at your friends.
Score, a direct hit.
Laser Floyd, which everyone went to see at the planetarium in various states of intoxication. And anti-aging lasers that women of a certain age would use to fry off layers of their skin to get rid of wrinkles. The downtime and recovery was a horror show. But, as they said with no irony in the 80s, we've come a long way, baby. And when one of my favorite dermatologist friends, Dr. Dendy Engelman, posted pictures of herself recovering in just 5 days from a Fraxel laser treatment, I decided it was time to take the laser leap. Want to see how it went?
Hi NextTribe, I'm Dr. Dendy Engelman. I'm a dermatologist here in Manhattan, and I actually have a fellowship, which is extra training in skin cancer surgery and procedural dermatology. So I do a lot of laser work, injectables, cosmetics, and aesthetics, in addition to general dermatology.
And she's so no joke. Like, Dendy, I know that there is such a thing as doctor-patient privilege, but I have seen some celebrities on your Instagram feed. Are you allowed to talk about whom you do?
Well, I can say who I'm allowed to say, which is Sofia Vergara.
Holy sh!
Christina Ricci.
She looks damn good too.
She's a beautiful soul. Beautiful inside and out. Both of those ladies, Kristen Chenoweth. We have some really pretty, lovely humans who I have the joy of treating.
About 2 months ago I came here and Dendy treated me with a Fraxel laser. Dendy, can you please tell everyone what a Fraxel or a fractionated laser is?
Yes. So a fractionated laser is anything where the laser beam is broken up into little zones. The original Fraxel was called Fraxel repair, and that was fractionated CO2. And CO2 is carbon dioxide.
And what does a CO2 laser do? Why is that a good thing?
A CO2 laser is the most powerful laser we have on the planet. We are on purpose injuring the skin, and that is something we rarely do in the world of dermatology. We always try to preserve and repair damage, but in this case we're using it in controlled zones of injury to resurface the skin. And in doing so, it stimulates collagen, elastin, helps with hyperpigmentation, helps with improvement of skin tone and texture, fine lines, wrinkles, basically everything that bugs you as we get older, it addresses. And so it is, to me and in the laser community, we all respect it as the gold standard.
Welcome to Solid Gold.
It's very interesting in that when we fractionate a laser, the way that wounds heal, the skin cells leapfrog over each other into the wound base. So if this whole surface is ablated, it takes a really long time for them to leapfrog all the way to the center of your face. And that's why scabs kind of heal in like that.
Oh yeah.
But if we have this area injured with the fractionated laser and this zone is untouched, then that skin can leapfrog in very quickly and heal the skin really, really rapidly.
God, you're good.
And we talk about this, and I think it's very appropriate for NextTribe, that we've all been on every side or different in LA, and you see ladies who you know are very much aged. You know, we know that they're not 22. They don't have a line or they don't have a wrinkle, but they also don't look young. It's almost like too much work can make you look older. We almost have to take our foot off the gas with the injectables and use tiny amounts to spot treat, but the heavy lifting needs to be in clearing the canvas. For my young patients who just want a little bit of collagen stimulation.
Would that be me?
Yes, like
Liar.
Cheryl. We can do what I call a baby Fraxel, where we really are dialing down the energy. The depth of penetration isn't that deep. They're basically going to have 1 to 2 days of downtime, and then they're back to normal, looking fresh. Medium depth, we would say for like 40 and above.
Okay, that's what I actually have.
And that's what I do once a year to myself. And I feel like that's the best way to kind of maintain skin health, skin's appearance, give a beautiful glow, help with fine lines and wrinkles. But we're not really having to dial it up because we don't have like deep set in etched in wrinkles. So I would say for late 50s into 60s, if you've never done anything, we have to bang you up a little bit in order to really see like reliable results that you're going to be like, okay, that was worth it. And so in the world of fractionated lasers, it kind of is no pain, no gain. And so you have to have some downtime in order to see true results where you're like, wow, that is amazing.
So as I will show you guys, I experienced, I'd say 4 days of downtime from my mid-level Fraxel. And Dendy, what do you think of my results?
I think your skin looks great. I think it looks glowy and pretty, and the texture is really improved, and the dyschromia or discoloration is better.
That's for sure. Dendy Engelman.
Yes.
Thank you so much for teaching us about lasers. If somebody from NextTribe or anywhere out there on the interwebs wanted to get in touch with you to come to see you, how would they do that?
You can follow me on Instagram. It's at Dr., which is just DR, and then Dendy, D-E-N-D-Y. I give tips every week, and you can see my cute little babies every once in a while, and you can message me there, and I will get you in to see me. You're basically injuring the whole skin surface, like if you ran your face down 2nd Avenue. Is that more than absurd? Well, you can call the office, which is 212-661-DERM. If you just ask.
Oh my God.
Or-
My phone number is almost KY Jelly.
I did not know that.
No.